presentation. Okay, so I'm now recording. So as I said, the first assessment that I want to look at is that multimedia presentation, which is your individual task for the subject. This is worth 30% of your overall mark for the subject. And the due date will be Thursday, the 30th of April at 12 noon. Of course, I'm open to people, as always, putting in extension requests if there are sort of extenuating circumstances that perhaps prohibits you from meeting that deadline. And of course, if you've got a learning access plan or a LAP, you can certainly use that, and you can just email me to request the extension. If you don't have a LAP, then the best way to put that extension request in is via the LMS and using that formal process. And that just keeps it within the system and just makes it fair to everybody. So if you need to make use of that, please do let me know. So for this particular assessment, you're required to visit an online local healthcare agency or an organisation from the list that we've provided, and to consider how the principles of public health practice are applied within those particular organisations. And then you're required to develop and submit a multimedia presentation based on that online site visit. So I have already put up a little bit of a video just touching base with the purpose of the assessment and outlining some of the expectations. But just to reinforce that, you know, some of you probably are scratching your heads, as I scratch mine right now, and think, well, why are we doing this? What's the purpose? Like, what am I going to get from this? There's a couple of reasons why we've done this assessment, and we've always had really good feedback from students about this, that initially they don't necessarily get why they're doing it, but once they've done it, they realise that they've got a better grasp on the principles of public health practice than they perhaps first thought. But also they've developed some really useful skills in terms of presenting information and using technology to do that. So there is that opportunity to actually see how the principles that we've been talking about in this subject are actually being demonstrated or not within organisations, what their public health scope of practice looks like, the types of strategies that they're using, the values that are underpinning their work, the partnerships that, you know, that are involved, that they're working with, but also how they collaborate with communities as well. So there's some really great real life examples of what we're talking about in this class. And so this is an opportunity for you to link theory with practice, but to do it in a really different way. And the reason why we do this is around engaging with technology, that if you look at all of your discipline competencies, most disciplines will have obviously communication skills, but also the ability to use technology. And for some, there are specific competencies about being able to communicate or deliver health information to a variety of audiences. And so this assignment allows you to build some of those particular skills. And then for the Bachelor of Health Science students in particular, next year when you move into third year, you'll be undertaking your field placement and will need to make a decision about which organisation you might like to do that with. And so this is an opportunity for you to look at some potential placement organisations and get a feel for what might be out there and where you might like to undertake your placement next year. The assessment does link to the subject learning outcomes, and in fact it contributes to all 4 of the learning outcomes, as you can see there on the screen. And I've explained that in a bit more detail in that video that's on LMS. So that's the purpose. So let's talk about the actual task. So what you need to do is to select one of the following agencies. So remember, we did modify this assessment with the changes to the fully online learning and no longer being able to do face-to-face visits. So we thought what we would do is actually provide you with a list of organisations where we know that they've got comprehensive websites that are going to give you access to the information that you need for this particular assessment. So you can choose from any one of the following. So you only need to pick one. There's Melbourne City Council, there's Headspace, we've picked Bendigo Community Health Services, Your Community Health, which is actually a Melbourne metropolitan-based community health service, Women's Health West, the Australian Migrant Resource Centre, and then finally the Victorian Aboriginal Community Controlled Health Organisation. So we picked a range of community health, local government, not-for-profit organisations. We've picked some that are more local, so specific to a geographic region, smaller region. Some are more state-based. So for example, Melbourne City Council, looks after the entire city of Melbourne. And then we've also got some, and then obviously the Victorian Aboriginal Control is a state-based organisation. And we've got some national organisations there too, like the Australian Migrant Resource Centre and of course Headspace. So there's a really good scope and variety. And I think that there'll be something for each of you to learn from these particular organisations. And you might want to have a look at a couple of them before you make your decision about which one you're going to focus on. So once you've made that selection, you can then go and look at their website to gather the information about how the public health principles are demonstrated or not, because sometimes what's not evident can be just as important and useful. And that'll come into play when you have to think about some of the limitations of what you're witnessing from your visit. So you'll jump onto their website and have a look at what's going on there. So when you're doing your online visit, you should consider and make notes on the following things. So obviously the first one is, what agency did you visit? Pretty obvious one. The other thing to look at is which local government area is the agency located in, or do they service? And as I said, some of these are state and servicing states, so the entire state of Victoria, and others are looking at more national population, so the whole of Australia. So you won't have a local government area for those, but what you would talk about are the demographics of the population that they're serving, which is that next dot point. So for example, if you're looking at the Bendigo Community Health Services, you would look at the demographics for the region that organisation services. If you're looking at the Victorian Aboriginal Health Service, then you would look at the demographics that they are servicing. So that would be, for example, Aboriginal and Torres Strait Islander people within Victoria. So just pick the demographics that are most suitable to the organisation and the population that they're servicing. Okay. You'll need to identify the type of agency that it is. So some of them are government, some of them are non-government organisations. There are some that are not-for-profits, there are cooperatives. So that information is, you'll usually find that information on their website in their sort of about section. If it's not available there, then the other place to look is at things like their annual reports to see where their main source of income is being derived from. And so you might see, for example, that in some of the organisations they're funded by state government, and so that would make them a government organisation. Others might derive their income from private sources or from fees that they charge to clients or patients. So just have a look at where the funding is, and that sometimes gives you a bit of an idea about the type of agency that it is. And then you'll also look at what are the aims and objectives or the key priority areas for that particular organisation, and how do they relate to public health. So there's two things there to look at. One is the aims and objectives or priority areas, and the second aspect is, which is really important, is how do they relate to public health. And so there you might want to be looking at things like the domains or spheres of public health practice. Or even things like, if you think about this week's topic, which is about primary health care, potentially linking it to different models of healthcare, whether it be that they're providing, more sort of biomedical based services, or whether they're providing sort of more comprehensive primary healthcare services. So what's important is the how does it relate to public health, because that's the level that we want to get you to. It's not just about being able to identify what the priority areas are, but how does that relate to public health? It's that application to public health principles that we're really interested in. In terms of finding things like their aims and objectives or priority areas, a really good place to look are organisations' strategic plans. So that usually sets out their things like their vision, their mission, their values, and then the key areas that they're working on. So that's always a really good place to start with. You might also see it under list of services, for example. They might have their services organised under key priority areas. But yeah, usually their strategic plan is probably the first point of call for that information. Okay, a couple of other things to think about is to look at the affordability, accessibility, and the availability of the services. And so the affordability might be, for example, are they charging fees for their services? And if so, who can afford that? And perhaps who's excluded, from being able to afford that and therefore access that particular service or that organisation. So, for example, if they're a private organisation and are charging sort of full fees, that there's no Medicare subsidy or no other sort of subsidy that's being provided, that excludes people from being able to access that particular service. So those are the sorts of things that we want you to think about. So thinking about in terms of also accessibility is not just the cost, but also the physical accessibility. So, for example, is there access to parking? Is there, access to public transport to get into that organisation? Is it even possible to physically access that organisation? There are some organisations where you actually can't go in there. It's not open to the public, but they're still providing services or resources. So think about that. Also think about, for example, people with a disability. From that point of view, is it accessible to perhaps people with disabilities such as wheelchair access? And then the availability. So, is it restricted to certain population groups? Is it restricted in terms of the time of the services? Are they only available, 9 to 5, Monday to Friday? And if so, what are the limitations of that? Who is potentially being excluded from being able to access that? You might want to look at things like, do they have access, or an availability, through online platforms, things like telehealth, which we're seeing a lot of at the moment. Perhaps online chat functions or counselling, or there's all sorts of ways that people might actually be able to access those particular services that they're being provided. And the availability might be, for example, 24/7 or restricted to certain times or days. So those are be critical when you're looking at some of these things, and don't just think about who has access, who can afford. Think about those who can't. So we want to think about where there might be some inequities for different population groups and who might be vulnerable. We also want you to describe the services that are provided by the agency and how they relate to domains of public health practice. So, for example, the strategies or the services that are being provided, are they, directed towards prevention? Are they more about sort of health promotion? Are they doing the work in the area of health protection? Or are they doing things like monitoring or surveillance? And it could be that these organisations are doing a combination of those things. And so you might want to think about how you present that particular information. So, for example, you might have the different domains of public health up on your screen in your presentation, and provide a list of the services under each of those categories to demonstrate, where they fit within these domains of public health. You'll need to also identify and explain how principles such as equity, social justice, consumer participation, stakeholders, determinants of health, models of healthcare, primary healthcare, health promotion partnerships, how these are being demonstrated or not in the agency. In relation to these, you don't need to look at all of these. My advice is that stick to the things that stand out the most to you. You won't have, the time or the ability to look at everything. And so perhaps be selective and maybe pick a couple of these to focus on in a little bit more detail. And as I said, sometimes it's looking at what's not being demonstrated can be really insightful, as opposed to just looking at what is being demonstrated. So for example, you might talk a lot about that there are different models of healthcare and that this organisation seems to fit within that sort of social model of health, and that's a real strength of that organisation. However, what's not clear from the online site visit is how they're engaging consumers in their service delivery and design. And so that could be a really interesting point to focus on, and what are the limitations of that. And then for the other thing we want you to look at is how is the agency and its programs and activities being funded. And as I said, that also helps you to identify, can help you to identify the type of organisation that you're looking at. So are they government funded, and if they're government funded, is that state funding or is it Commonwealth funding? Maybe they're deriving some funding from, charities, or maybe they're funded purely privately. So we want you to have a look at where that funding is coming from. And one of the places that you can look for that information is usually in things like their annual reports. But sometimes they will also have that published, in their section, about the organisation. That's usually provided. Okay. All right, where to find the information. So I've touched on some of these already. So strategic plans are great. And most of these organisations, in fact, I'd probably say all of them have got a strategic plan. And usually they are publicly available. Okay, so start with looking at those. Annual reports, don't just be limited to the most recent one. You might need to go back and have a look at, a few years worth of annual reports. Have a look at things like media releases. So sometimes these organisations will have a site dedicated purely to media and publicity. Have a look at what they're releasing in terms of that, the statements that they're making. So for example, Women's Health Services will often produce media releases in terms of the programs that they're announcing, or it might be in terms of the advocacy work that they're doing. So yeah, have a look at media releases in their press page. Some organisations will have policy documents that are available to the public to have a look at. So see if you can find some of those. Some of them will have reports or other publications about their specific program. So for example, it might be an evaluation report of a program that they've run. They might have fact sheets that are available to their clients or community that outlines the types of services that they provide, what they're about. So have a look at those. And lots of these organisations have other publications and resources, so they often have a dedicated site. So it's also worth having a look there to see what else you can find. Some other sources to look at in terms of particularly getting an idea about sort of the demographics of the population include obviously the Australian Bureau of Statistics. Sorry, was that a question? No. Have a look at the ABS. So the ABS have the most up-to-date census data for local government areas, but also you can get sort of state-based and of course national data about the population. The Australian Institute of Health and Welfare produce a report every year called Australia's Health, and that has up-to-date data about a whole range of health issues that we see across the country. Always a really good resource that you can tap into. You might want to have a look at local government websites. So for example, if you're looking at the Bendigo Community Health Services, you might want to go and have a look at the City of Greater Bendigo's website, because that has local government profiles and provides information about the population within that particular local government area. So that's always worth looking at. And then, of course, there are things like textbooks and journal articles and other electronic sources that you can use to help you make those connections between what you're seeing in these organisations and how these are a reflection of public health principles. So in order to be able to explain those principles, you can draw on these resources. And remember, there's lots of resources on LMS in the SWAYs. There's the reading list. You've got weekly readings that you can tap into. We've also got additional resources on the LMS page that you can use. So there's lots already in LMS that you can tap into without having to do a whole lot of extra work trying to do research and find additional resources. So work smarter, not harder. And by smarter, I mean use what you've already got access to. Okay. All right, let's talk about structuring the actual presentation. So once you've gathered all of that information, you're going to turn that into a 10-minute, about a 10-minute multimedia presentation. Now, I often get asked questions around, well, is it okay if I sort of go up to, 15 minutes? Yeah, that's fine. I wouldn't want you going up to 20 minutes. I think that's way too long. But I also think that anything sort of under that 10 minutes, you're probably not doing the organisation or yourselves justice. So I'd aim for around that 10 to 15 minutes if you can, okay? And we've provided you with the structure, but you can be creative with how you present this information. So you should have an introduction. So just like you would any other type of presentation, or even a written assessment, you need to provide us with an outline of what's going to be included in the multimedia presentation. So that should include things like, obviously, the agency that you visited, the location of it. So just, the physical location of the office, for example, the type of agency that it is. So is it government, non-government, not-for-profit, etc. And then a brief overview of the points that you're going to cover in the presentation. So that probably takes sort of, a minute to a minute and a half to deliver that, I would expect. You'll then go into a description of the services. So this is where you can draw on that information around the aims and the objectives of the organisation. You could look at things like the values, so drawing on their strategic plan. These are the values that underpin their work. The target population, so this is where you can bring in some of the demographic information, the types of services or activities or programs that they're providing, and linking those to domains of public health, and then their funding arrangements as well. And so you should be linking all of this to how this relates to public health, okay? The next bit is around an explanation of how principles such as equity, social justice, etc., are being demonstrated. And there's lots of ways that you can do that. And what I'll do once I've gone through all of this is I'll actually show you an example of a multimedia presentation from a student in previous years so that you can get a bit of a sense of what this might look like, okay? So we want you to discuss, what you're seeing in the organisation in terms of some of these things. And as I said, you don't need to look at all of these. Pick out a couple of them and focus in a bit more detail about these. The other thing that we do want you to think about are the limitations of this service in context of public health principles, and to make some recommendations for future public health practice. So, for example, I said before that you might not be able to see how consumer participation is being demonstrated. So that might be a limitation that you would talk about. And then you might make some recommendations in terms of future public health practice. So, for example, the recommendation might be that this organisation considers how they engage with consumers, and maybe make some recommendations about what that could potentially look like for that organisation. And so you would draw on the materials that we've got for later on in the semester around consumer participation, collaboration, partnerships, for example. Then you'll have a conclusion. So that's a brief summary of the points that you've presented. And of course, you'll have referencing. So you will be referencing your slides. So you'll need to include in-text referencing, and you'll have a complete reference list at the end of your presentation as well. And all of that should follow the APA 6 guidelines. Okay. All right, so a couple of key requirements for this assessment. So your multimedia presentation, multi meaning more than one, needs to have a voiceover. Okay, so we must be able to hear you talking through the presentation. It must have photos, maps, or some other visuals. Okay, and you can source those from the organisation's website, or you could use things like Google Images. Just check copyright before you use things, and also make sure that you are acknowledging photos if you're taking them from these organisations or from Google Images, for example. You could use things like Google Maps or Google Street View, for example, to show the location of the organisation. But again, just make sure that you're referencing those appropriately. The other thing that you must include is the key information in the written format on your slides in some way. And that might be, dot points, it might be diagrams, it might be just a few bullet points, or some quotes. It's up to you. You can be as creative as you like, but it must be key information. So it's got to be meaningful information. And it's got to be information that matches the voiceover. So just as, I've got here, this is essentially what I'm delivering is a multimedia presentation where you can hear me. And I've got key information up on the screen on the slides that I'm talking through. And those points match what I'm talking about, okay? And then the other requirement is the in-text referencing for that key information, and of course, any photos or other visual images that you're using. All right. The marking guide. So there's essentially 3 criteria that we're marking you on. So the first is around the content of the multimedia presentation. So that overall is worth 15 marks. And so what we're looking for is, just as I've gone through with you, you're clearly stating the agency, the location, the type of agency, and you provide a brief overview of the presentation, so that introduction. That you describe the services, including aims and objectives, their target population, their activities, their funding arrangements, and you discuss how these relate to public health. Okay. That you've considered affordability, accessibility, and the availability, that you've explained how principles are being demonstrated or not in the agency, and that you outline the limitations and make some recommendations. Okay, so the marking guide matches the structure that we've provided and those key points that we want you to consider as you're doing that online video, that online research, sorry. There are marks attached to the delivery and the organisation of the actual multimedia presentation, so 10 marks. So that is, you've got that introduction, that you maintain the structure throughout, that it's well timed, that you've got that voiceover, but that it's also really clear and articulate. So we've had instances where students have submitted it and they've got a voiceover, but we actually can't hear it. The quality is really poor. And if we can't hear it, we can't mark it. So they've actually lost marks in this section. So just make sure when you're recording this that you are clear, that you've got no sort of background noise that's likely to come through on that recording. We're also looking at the language that you're using. So we want you to be using language that reflects a public health approach. So using the language that we've been presenting to you through the readings, through the sways, but also through these online Zoom sessions and the previous face-to-face workshops as well. There's marks for graphics, sound, and or animations, and that's about how appropriate they are. So we wouldn't want you to have a whole lot of animations or sounds that actually don't link to the presentation because they then just become distracting. So you want to make sure that they're actually enhancing the presentation and not detracting from what you're trying to actually communicate to us. We want to see a consistent visual theme throughout. So, you know, if you're going to do like a PowerPoint like what I've done here, just making sure that that's consistent. Your colors, your fonts, etc., are the same throughout. We wouldn't want you changing the format or the layout or the theme that you're using on each slide. So keep it consistent, keep it professional looking. Fonts need to be easy to read and that your font size varies appropriately for headings and text. You can use things like italics, bold, indentation, provided that is actually enhancing the readability of your information. Text needs to be appropriate for the target audience and needs to be to the point. So you wouldn't want to have slabs of text on a slide. That's really difficult for the audience to read and to take in. And you wouldn't want to have a whole lot of text that you're just reading out as well. So try and keep it to sort of key sort of bullet points and then use the speech to actually expand on those particular points. Think about things like the background and the colours that you're using. So you wouldn't want to have a dark background and dark text. That can be really difficult to read, particularly on the screen. You know, think about either dark background light text or light background dark text. Okay, so think about that contrast. Yeah, you want to make sure that we can actually read this. So do a run through to see how it actually comes up on your screen. Because how you see it is how we're going to see it because we're marking these online. And then we also want a bit of a summary or a conclusion along with your recommendations. So some sort of conclusion to the presentation. And so that's about that topping and tailing of your presentation. And then finally, there's 5 marks for referencing. So in-text referencing obviously follows APA guidelines. If you're going to use some direct quotes, and you might want to, you can do that. You can take things directly from their websites or their reports, but they need to be appropriately cited, okay? And that you've got a full reference list at the end, and that also follows the APA 6 guidelines, okay? I've only just taken for the purposes of this PowerPoint, just the criteria. When you look at the marking rubric online, you'll see what it is that is an outstanding presentation versus a really poor one. So we've given you some indication of the things that we're looking for, you know, in terms of how the marks are being awarded across each of the criteria. Okay, so have a look at that. All right. That was a quick run through. Does anybody have any questions before I show you an example? Any questions at this stage? No, is this helpful? Anybody out there? All right, I'm just going to pull up the example one. Let me just, what I've done with that. There we go. Okay. All right. Okay, so this example that I'm going to show you was done by a dentistry student a few years ago.
Hi, my name is Fatima, and the local healthcare agency that I'll be discussing today is the Dental Health Services Victoria. So the purpose of this multimedia presentation is to explore the DHSV by identifying its organisation's aims and its objectives, as well as its location, demographics, funding, and its stakeholders. And then I'll be discussing its target population and its services and programs, and how all of these relate to the principles of public health practice. I'll be focusing on the principles of equity, social justice, and affordability and accessibility, as well as the social determinants of health. Then I'm going to explore the models of healthcare, as well as the limitations and recommendations for the organisation. So the DHSV was established under the Health Services Act in 1988, and it's a leading public oral health agency in Victoria, which aims to improve the oral health of all Victorians. So in the diagram there, you can see the aims and objectives. So the DHSV provides dental services through the Royal Dental Hospital in Melbourne. It develops current workforce and supports the education and training of future oral health professionals. It fosters and supports and also participates in oral health research. It also supports the department on policy, funding, and service development. It also helps develop, deliver, and evaluate oral health promotion programs across Victoria. And it's also involved in purchasing dental services from community dental. DHSV has 6 key priority areas. Now, the first one being health outcomes. So it looks at how it can produce a value-based healthcare model to achieve best evidence-based practice. Second of all, it looks at quality. So it wants all of its clinics and its associated affiliations to be under the National Safety and Quality Health Service standards. Thirdly, equity. So it wants a more universal healthcare principle, and that ensures that everyone has access, and especially those with greatest need. Fourthly, efficiency. So a funding model that provides optimal health outcomes, and also accountability and responsiveness, and ensures timely access and enables favourable visiting. DHSV is located in both metropolitan and rural areas. So we have 44 fixed clinics and 2 mobile clinics in Metro Victoria, as well as 50 fixed clinics and 4 mobile clinics in rural areas. Victoria's demographics. We have about 6 million residents. Our population growth's increased by 10.7%. The Aboriginal and Torres Strait Islander population is 48,000. Our median age is 37. We have slightly bit more females than males. So most people were born in England, followed by India, China, New Zealand, and Vietnam. We have about 1.7 people that are born overseas. Of course, English is the most spoken language. However, that's followed by Mandarin and Italian and Greeks. About 31% don't have any religious affiliation, followed by Catholics and Anglican. And the median family income is about $1,715. Now, the DHSV provides a lot of services, and this includes emergency, general, and specialist dental care. It also provides oral health promotion programs that I'll be speaking to you about a bit later. It also purchases services. It's involved in community liaison, IT, management and reporting analysis, as well as agency relationship teams. It also has clinical leadership programs as well as educational services. Now, the graph that you can see there, it describes the government funding activities from the period of 2016 to 2017. So we can see that the government spent most of its funding on community dental care as well as Royal Dental Hospital dental care. That was followed by system resourcing and management. Now, the government spent its least on annual provisions, and that was followed by oral health promotion and workforce resourcing. So now that we've explored what the DHSV is all about, let's look at how this organisation applies the principles of public health practice. Now let's begin with equity. Now, equity refers to the fair opportunity for everyone to attain their full health potential, regardless of demographic, social, economic, or geographic stripe. So the DHSV, what it does is that it aims its service at particular target groups who are among the most vulnerable in our society. And these target groups have priority access to their dental care services. And these include children between 0 to 12 years of age, young people who are on healthcare cards or dependents of concession card holders, 2 to 17-year-olds, Now, to ensure that these target populations actually receive the care that they need, the DHSV produces policy statements and submissions on pressing issues that Victorians face. Now, these policy statements and submissions are aimed at informing the government and specifically policymakers about a wide range of health issues. So things like disability, women's and men's health, food and drinking guidelines. So establishing social justice. Now let's zoom in to the bottom right of that slide on the comment on healthy choices. So what DHSV did is that it showed proactivity by using the healthy choices policy, and it found a way to improve oral health, which is the organisation's main aim and objective. And it influenced policymakers, and therefore we've received this food and drinking guideline for Victorian hospitals. And this can be seen in other policy statements and responses that are seen on the slide there. So in terms of affordability, priority groups, they receive free emergency care as well as free general dental care. Adults with concession cards, they receive emergency care and general dental care at a reduced cost. Now, adults with no concession cards, they receive emergency care at about $235. And they're actually not eligible for general dental care, as you can see on that table there. Now, of the eligible population, 82% live within 10 kilometres of the nearest public dental clinic, and 8% live within 20 kilometres of the nearest public dental clinic. DHSV also has domiciliary services, and they're services that are provided to people who are homebound. So people of private homes, nursing homes that can't actually travel to these clinics. And they also have special care units at the Royal Dental Hospital, and their services for people with disability. So this picture is interesting. It shows us a tooth that's plunged deep into the ocean. So the top of the tooth surface that we can see, it depicts the oral health status or the outcome. Now, to get to the status, we have causes, and these causes deep down come from social determinants of health. Now, these social determinants of health include psychosocial and cultural determinants, and these determine lifestyle behaviours, and together with contributing factors, they result in the oral health status. Now, the DHSV, it works very closely with the work social determinants, which ensures that people on low incomes or no income have access to affordable treatment. It targets people on low socioeconomic groups, so it promotes good oral health and it provides affordable and accessible services. In regards to food, it promotes healthy food and drinking diets. It also has the healthy choices policy that we discussed earlier. In terms of early health or early life, it ensures that children have a good start in life, and it supports mothers and young children. And we'll be talking about the Smiles for Miles program in a while, as well as transport. So like what we talked about earlier, accessibility and the domiciliary service. So these are just a few of the health promotion programs that the DHSV is part of. So the Smiles for Miles is a program that helps to teach young children on just good oral health care and oral health practices. Bigger Better Smiles is for Aboriginal health service providers, and it teaches them oral health so that they can then depict that onto the Aboriginals that they deal with. Healthy Families and Healthy Smiles is a program that is also targeted at young children and pregnant women. Tooth pack distribution, that resulted in about 12,000 packs distributed to various families across Victoria, and also promoting oral health within disability services. So I believe that the DHSV, it depicts a comprehensive primary healthcare model as well as selective primary healthcare. And I think this because it emphasizes on things that generate oral health and prevent oral diseases. It emphasizes on social justice, community control, and working for social change. It also concentrates on providing medical interventions that are aimed at improving the oral health status of most individuals at the lowest cost. And lastly, it does depict a social model of health because it addresses the broader influences on oral health, so social, cultural, environmental, and other factors that affect health rather than disease. And now I think that this diagram really depicts how the organisation applies these models of healthcare. So as you can see, this framework is founded on the pillars of equity, diversity, inclusion. And it involves the community, not just the professionals themselves, but the consumers, the carers, and the families, as well as the other key stakeholders that we mentioned before. So this table shows you the limitations that I think lie within this organisation. So number one, the current funding focuses on clinical interventions, so things like diagnosis and treatment and disease management. The recommendation would be to focus on oral health promotion and non-clinical prevention activities, and this has shown to improve oral health significantly. The second limitation is that only 12 to 18% of those who are eligible are actually treated, and this is due to lack of dental clinics and dental professionals, and this leads to long waiting times. So a recommendation for this would be to improve the responsiveness and facilitate acceptable waiting times by increasing the number of clinics and dental professionals. And lastly, the limitation that I found was in a report saying that 31.7% who are not eligible for services don't visit or delay visiting the dental clinics for basic care. And a recommendation for this would be to extend the funding, and that will help decrease barriers and increase access for disadvantaged Victoria. And this is my list. And thank you for listening.
Okay, I am just going to open it up for comments or questions that people might have after seeing that example. What do you think? What are some of the things that you perhaps picked up on? I'm just going to pause the recording, so in case you're a bit shy. Okay, so the annotated bibliography, so this is that assessment that we had to change. So originally you were going to lead a class discussion based on one of the weekly readings, and we've had to modify that. So this is what we came up with. So I'll talk through this and we'll go through the marking guide, and I can give you some hints and tips on how to address this particular one. So this is your group assessment. So you're working in those same groups that you were in for that original assessment, that the discussion leading, okay? I have set the due date for this for the end of semester. So it'll be due at 12 noon on Friday, the 5th of June. And the reason why I've done this is because one, it's a big change in the assessment, but also I think that you need some time to be able to do the readings, to look at the content in order to be able to do a bit of justice to this. So I just wanted to give people the time and the space to be able to do this assessment. It is worth 20% of your overall mark for the subject, and the word count is 1,500 words, and as always you've got that plus or minus 10%, okay? And so as I said, you'll be working in groups of 2 to 3, and you'll select 4 of those required weekly readings, and then prepare the annotated bibliography. So this is the list of the readings. These are in the instructions. All of these are embedded in the library reading list. So to access those, all you need to do is go into LMS, click on the reading list, and it'll take you to these readings. So you don't need to go outside of LMS to access these. Okay. So you and your team can select any 4 of these that you like. So whatever speaks to you, whatever ones are of interest, go with those. Okay, so don't pick something that you struggle to understand, that you're not really interested in. Don't pick it. Pick things that that you can understand and that you're going to be able to provide a summary and a critique of. Okay, something that's got some interest to you. I don't care what four you pick. Totally up to you. Okay, so negotiate with your team members. The purpose of this assessment is, there's a couple of things that I wanted for you to get from this. And one is, there's a whole lot of reasons why we might do an annotated bibliography. And so typically they're done to inform, or provide key information for later assessments. So for example, you might do an annotated bibliography, and then, that might lead into another assessment, which might be a report or an essay or some research or whatever. But for me, the reason why I went with this is that I wanted you to be able to demonstrate that you've got some understanding of the principles, that you're able to put in your own words, the key points that are being raised in these articles about public health. And for you to be able to summarise and critically evaluate these, and to also reflect on your own thoughts and beliefs about these particular papers. So it's a way to engage with some of the literature around principles of public health, and to help you to get a deeper understanding about those principles. But also, one of the things that we're asking you to do is to think about how this might relate to your disciplines as well. Because I think it's all good and well that we can sit here and talk about these principles, but as students, you want to know, how is this going to be relevant to me and what I do as a paramedic, as a health promotion practitioner, as somebody working in sports development, as a teacher, as somebody working in rehabilitation counselling, whatever discipline you're in. We want to be able to think about, what does it mean for me? And so that's one of the things that we'll be asking you to do in this assessment, is to very just briefly articulate what this might mean for your discipline and the work that it currently does, or the work that it could be doing. I always a big believer in this subject about, yes, providing you with theory, but also getting you to look at the application of that and applying that within a discipline context. Okay. So just in terms of what an annotated bibliography looks like, because I'm quite aware that you probably have never done one before, you've probably never even seen one before. So an annotated bibliography is arranged in alphabetical order by the author's family name. So just like you would in a reference list. So what you'll end up with is these 4 pages, so one for each of your articles. At the top of each page, you'll have the full reference for that article using the APA 6 style. Okay, so full reference goes at the very top of the page. So as opposed to an essay or a report where you put the reference at the end in a reference list, in an annotated bibliography, the reference comes first. Okay, so that's what you'll always start with. And then there's a brief annotation. And so we're looking at about 250 to 300 words. So it's brief. So you're going to have to be really clear and concise in your writing in this particular exercise. And so you can see on the screen here that this is an example of the length that we're talking about. So it's not long. And you're going to have 4 of these. So one for each article that you pick. Okay. And we'll talk a little bit more about this bit here and what that should look like, what you need to include. Okay. But visually, this is what it looks like. This is just another example. So again, you can see here, we've got the full reference at the top and then the annotation underneath. Okay. And again, you can see it's a paragraph. Okay. 250, 300 words is a paragraph. This is not about writing extensive pages of text about these articles. Okay, so what do you include? So obviously there's the full reference using APA 6, and then the annotation for each article should include, for example, the aim of the paper. So that might be a sentence about, a brief explanation of the topic or the theme of the article. So for example, what are the principles of public health that are being addressed in this particular article that you've selected? So for example, if you pick the article, I'm just going to quickly jump to the list. If you picked the week 7, the health promotion article by Bernie Ward and Glenda Berender, you might in a sentence say that the aim of this paper is to use the Ottawa Charter to examine how nurses can apply this in terms of young people and alcohol misuse. A sentence that immediately tells me that what this article is about. You can include something about the research methods if it's applicable. Now, not all of these articles that we've got have got a methods section, because some of them are not actual research articles. They're more commentaries or opinion pieces. So if it doesn't have a research method in the paper, then you don't need to talk about it. However, if it does, then I would expect to see some mention of that in the annotation, and that would be a sentence or two. You would provide us with a little bit around the key arguments in the source. So what are the key points that they're trying to make? Is it, for example, if I use the health promotion article, the Ward and Verender article, are they trying to put forward the argument that the Ottawa Charter is a suitable framework for examining alcohol misuse in young people? Okay. Or is it that they're looking at the types of strategies that nurses can use in this particular, in relation to this particular health issue? So again, you're talking probably a sentence or two. You'll include something about the limitations. Now, that could be limitations in relation to research design. So if it's a research article and it has a methods and a results section, you could do that. Otherwise, you might talk about some of the limitations in relation to the arguments or the points that haven't been considered in the text. You might want to make some points around the readability or the usability. So perhaps, you found this article really difficult to understand and unsure how this could be utilised by professionals perhaps within your discipline, for example. You could, discuss the credibility of the authors. So having a look at, what in each article, usually there's some detail about the biographies of authors or their organisations or background. So some of that's often included. Look at that and perhaps critique that. So you talk about anything in terms of the limitations. You don't have to do all of these. There's too much here to do. And as I say, some of it won't be applicable, such as the research design stuff, if it's not actually a research paper. Then, so we're talking probably, again, a sentence or two there. You'll identify any conclusions made by the author or the authors. So what are they saying? What's their conclusion? So for example, in Ward and Verender, the conclusion might be that the Ottawa Charter provides a really useful framework for nurses to undertake health promotion work when looking at alcohol misuse and young people. So again, a sentence. And then some conclusion. So this is where we really want to see your views and your reactions to this text and how relevant or useful this might be for your discipline's practice. If you're in a group, incomplete sentence there. If you're in a group with multiple disciplines, you could approach this in two ways. You could pick one of the disciplines and talk about how that article might relate to that specific discipline, or you could actually talk about it more generally in relation to those disciplines. You could look at all of them. I'll leave that up to you. I don't have a preference. I think that if you looked at just one discipline, then maybe take it in turns with each article, okay, so that each discipline gets covered in at least one of the articles. But I'll leave that up to you. I just want to see you making that connection to discipline, okay? The formatting, so as I say, the citations, so your references should be presented in alphabetical order and follow the APA 6 guidelines. And each of your annotations and citations should be on a separate page. So one page per article, okay? Full reference at the top, full reference, and then your paragraph. Okay. Each annotation should be clear and concise. So say that 250 to 300 words. You don't want to be writing, 500 or 600 words or 1,000 words, way too much. So this is a summary, not an essay. So keep it to that paragraph. And the other thing is, you only need to mention significant or relevant details. So for example, you wouldn't launch into, include things like the title of the article in your annotation, because you've provided the reference. We know what the article title is. You could just go straight into the aims or the purpose of the article. You don't need to rehash information that we can gain from the title. Okay. So keep it to just the significant and relevant details. Background materials and references to work by the same author usually are not included. So as you're addressing one text at a time, there's no need to cross-reference or to use in-text citations to support your annotation. So you just provide the full reference at the top of the page. You don't need to provide any further in-text referencing. Okay. And then you should write in full sentences using academic vocabulary. So I don't want to see a whole lot of dot points. This should be in proper paragraph form, and use 1.5 line spacing and size 12 font preferably. Okay. Some tips. So this is in the instructions for this assessment, but just some things to help you to think about when you're analysing your sources. And this can be really useful, some of this stuff in terms of thinking about the limitations, the usability, the relevance of this, is thinking about who is the intended audience of the paper. That can be really useful in trying to identify how usable and how readable it is. Is the author presenting their opinion, or is it interpretation as the truth, or are they stating facts? Are they using evidence and references to support their opinions? If they're not, then, there's some potential limitations to that. Look at, did the author perform the research if it's a research paper, or are they curating or presenting the research of others? Because then there might be some limitations there. If the author used the research of others, are those sources credible and have they cited those appropriately? You could look at things like, are there errors or omissions of fact? Is the author writing objectively or without bias? And then also consider the value each source provides to you as students, learning about public health principles. So what's your reaction to this particular article? Is it overwhelming? Is it confusing? Is it really clear? Is it really obvious how this might relate to your discipline and the work that your discipline does? Do you share the same or similar views as the authors, or do they differ? Did you take something, else away that the author hadn't considered? And if so, you could talk about that. How is this useful for your discipline? And is the source providing you with a different perspective, or perhaps changing your beliefs or thinking about public health as well? You don't have to address all of these in the annotation. This is really just to help you to, when you're reading the article, to try and critique and think about some of these things that you can then use when you're actually writing that annotation. Okay, you don't have to do all of this. These are just some guiding points. The marking guide for this, so it's fairly, a basic breakdown. So we've broken it down to sort of introductions. So in each paper, we'd like to see, obviously, the aim of each paper is clearly and concisely articulated, that you've identified the relevant public health principles in the article, and that you haven't included information that's apparent in the title of the text. Okay. The annotation itself, so there's 5 marks per citation. So we will mark each one as a sort of a separate entity. And so we're looking at that you've got a summary of the research methods provided, only where that's applicable, that you've got a short summary of the theory or the research findings or the arguments, and that they're concisely articulated, that you've identified any conclusions made by the author, and that there's some consideration of the limitations of the paper as well. And then a conclusion, so we want to see that you have articulated your own views and conclusions about the articles, and some links to the relevance or the usefulness of the text in relation to your discipline. There's marks there for referencing, so having that full citation at the top of the page, and then that referencing follows the APA 6 style. And a few marks there for the presentation and the written expression as well. So that each citation is presented on a separate page and that they're in alphabetical order. 1.5 line spacing, appropriate academic writing, concise, that you're fluent, grammatically correct, no spelling errors, just general neat presentation. And then including things like the page numbers, your names, and your courses in the footer as well. Okay, so it's a fairly basic marking guide. All right, any questions? So I'll